So when you enter the cubicle and you start your consultation, what do you start with? You start with introductions, making the bonding, reassuring the patient that you are there to help. So for that, the mnemonic that will help you is GRIPS. Greet the patient. G for greet, R for rapport, I for identify, P for purpose, P for privacy. So there are two P's. And S for social courtesy. So G for greet. Greetings. Hello. It's a neutral word. You could say it in the morning, you could say it in the afternoon, in the evening. Hello. Hello, Mr. Smith. Or if you want to use good morning, good afternoon, you can do that. But then try to remember which time is your session. Which time is your exam? Is it in the morning session or in the afternoon session? So morning session, good morning. Afternoon, of course, good afternoon. Mr. Smith, Mrs. Smith. Expressions. You would say that hello or good morning, good afternoon with a smiling face. If, according to the nature of the task, of the station, if the patient is looking so stressed and so upset, then of course, you would smiling face. For example, if the information is that the patient was treated and the patient is all fine and the patient is going home, now you have to go in and consult the patient about their medications. So the patient is all happy. Oh, doctor, I'm so happy. I'm going home now. Yes, hello, Mr. Smith. Yes, I can see that you are quite happy as you're going home today. So, however, if it's a Breaking Bad news station, however, if it's a station where you or your team have made a mistake, patient is angry, the patient is stressed, they're worried, then you would have a serious face. Good morning, Mr. Smith, with a serious face, serious tone. And that goes with the second component, that's your rapport, your bonding, your connection with the patient. So you should have the right body language. You should have the right facial expressions. I is for identify. You would identify yourself, introduce yourself. Be brief in this section. Do not waste a lot of time. You only have 8 minutes. So not too much of this, this name, that name, how should I call you, this, that. No, just be quick. Get on with it and move on to your main task. Hello, Mr. Smith. I am Dr. Malik. I'm one of the junior doctors in GP. I'm one of the junior doctors in accident and emergency. And then you would confirm their identity. May I confirm, are you Mr. Charles Smith? So you would confirm. It's easier and quicker to just go with their surname. Are you Mr. Smith? Mr. Charles Smith? And if the patient says yes, then you would continue calling him Mr. Smith, Mrs. Smith throughout the 8 minutes station. Unless the patient themselves says to you, doctor, it's okay, call me Charles. Okay, thank you, Charles. And then you will call them Charles. So it's easier, it's quicker that way. If, for example, it's a child, 9 years old, Adam Smith, is here with his mother to see you, then you would call the child with his first name. So with an adult, you would call them, start off calling them with a surname. Mr. Smith, Mrs. Smith. Child, you will start off calling with their first name. Adam, Sarah, 9 years of age. And Then it comes to the task says mother of Adam Smith. The name is not given. Then you could ask, may I confirm, are you the mother of Adam? Are you the mother of Sarah? Yes. How would you like me to call you? Okay, call me Charlotte. Okay, Charlotte, please tell me what happened. So then you would just carry on with that. If you forget the name of the patient that you read when you were outside the cubicle reading the task, you have two options. One, you just continue with your station without saying the name. Please tell me this, please tell me that. Could I examine you? Don't say the name. Or you could ask the examiner again, as I said previously, excuse me, examiner, may I please look at the task again? Have a quick look at the task, remind yourself of the name, and go back and start your station again. The next is the P, purpose of consultation. Sometimes the purpose of the consultation is mentioned in the task. Mr. Smith came to the clinic 2 weeks ago, was seen by your colleague GP as he was complaining of cough, and your colleague arranged some tests for the patient, including blood tests, x-rays of the chest. Mr. Smith is now back to see you to discuss the results. So you know the purpose of the consultation. You would summarize that. Mr. Smith, what I gather from my notes is that you were seen by my colleague GP 2 weeks ago because you were complaining of cough. And my colleague arranged some tests for you. And the reason I'm seeing you today is to discuss the results of those tests. Is that right? So, confirming the purpose of the consultation. The other possibility is the purpose is not mentioned in the task. Mr. Smith is here to see you, talk to the patient, address their concerns, and manage them. So you have no information about why you're seeing Mr. Smith. Mr. Smith, how may I help? So you would ask them the purpose of the consultation. They would tell you why they're here. Oh, doctor, I'm here because I've got cough. The next thing is privacy. Talk about the privacy, especially it's important in certain stations, more than others. For example, it's a breaking bad news station. You do not want to be talking to and breaking the bad news to a patient in the middle of the ward. You would want to arrange that meeting in a separate room. So privacy in breaking bad news. The other important thing is to inform and verbalize that you are ensuring privacy when you are doing examination. Mr. Smith, is it okay if I could examine you, please? I will ensure privacy and have a chaperone with me. Chaperone will be a part of your privacy. And how do you ensure privacy in examination? What do you mean when you say, I will ensure privacy? You ensure privacy by drawing the curtain around the bed. You draw it by closing the door. And also you would say, I will have a chaperone with me. Chaperone meaning a colleague of you, like for example, a nurse, who would come and stand with you when you are doing a private examination of a private part. Generally speaking, any examination of the trunk, any examination of the private parts up to the knees, you would need a chaperone. So mention that you will ensure privacy and have a chaperone. And remember, for example, the patient says, it's okay, doctor, my mother is here. You carry on with your examination. Is that acceptable? No. Patient's relative is not a chaperone. Thank you, Mrs. Smith, but I think it would be better if I could ask one of my nurse colleagues to be here as a chaperone. So a chaperone is a colleague of you, not a patient's relative. The next thing is, the final component of GRIPS is S, social courtesy. Keep your social courtesy throughout the consultation. Please, thank you, sorry. And if, for example, Mrs. Smith is sitting here in the chair with you and consulting with you, and you would now want to examine, for example, Mrs. Smith's leg and foot for diabetic examination, then you would help Mrs. Smith if, for example, she is a bit limping or she's got a stick. May I help you, Mrs. Smith? Do not just go and grab her arm. Ask for consent. May I help you, Mrs. Smith? And then, she would say, no, it's okay, doctor, I will manage. Or yes, doctor, please help me. So that's your GRIPS done.